Hello, it's Dr. Christine Arseneau, PharmD, Functional Medicine Certified Health Coach, here on this rainy Friday in the Bay Area, Northern California here. Today I wanted to talk about something that's very important for your mindset and figuring out your treatment path, and that's the why versus the how. And people tend to focus on the how, especially in Lyme disease, because you often feel like practitioners are not able to help you, and maybe different doctors have failed you. So you really kind of feel like it's up to yourself to figure out how to heal yourself. So you get very focused on the how and which protocol do I do, which protocol is going to work. And so I see people in groups always asking, what protocol did you do? Can you post your protocol? Post your protocol. But the thing is, it doesn't really provide value to you if I were to just post my protocol, because my protocol is not going to be your protocol. Because the way that I healed was to look at all the different areas of my life, and no one person out there is going to have the same environmental factors as me, the same exposure to chemicals and toxins, the same negative thought patterns and limiting beliefs and feelings of not being good enough, and my genetic mutations, vitamin deficiencies, or different statuses of your nutrients. There's so many factors. So there's not going to be one person out there that meets all of the same criteria, that has the exact same makeup as me. So my exact protocol is not going to work for everybody. And it wasn't necessarily an exact protocol that was set in stone. It's like you have to treat as you go and see what comes up, and perhaps back down on your dose if you're herxing, and it's this whole thing that you have to navigate and address as things come up and do additional testing as you go. So just handing somebody a protocol of what I did wouldn't be helpful, because it wouldn't apply to most people. Like there's different co-infections. I had issues with yeast and candida, and everybody's different. Everybody has different symptoms. So the same protocol is not going to work for everybody. And when you're focusing on the how, it takes you away from focusing on the why. So there's this thing called the training balance scale, which is your how versus your why. And so the why is your motivation, your thoughts, your attitude, your dreams. And this really should be like 99% of the focus. And then the how is somewhat important, but if you focus on the why, the how just comes. And so the how would be the skills and strategies and the doing and the action. And you need some of the how. I'm not saying you shouldn't be educated on your disease, but if you're so focused on finding that exact protocol and you're so focused on killing the bacteria, you're focusing on what you don't want. And when you focus on your why, it just opens you up to new possibilities. So why do you want to get well? What does that look like for you? What would you be able to do that you can't do now? What would it feel like to be fully well? What if you didn't have brain fog? What if you could think clearly? What if your fatigue wasn't so ridiculous that you could barely even walk to the fridge? What if you had the energy to play with your children or your grandchildren, to build a better connection with your significant other, to put more focus on your career? This disease affects everything. It affects your relationships. It affects your income. It affects your whole life. But if you're so focused on killing the bacteria, you're focusing on what you don't want. And we all have a frequency that we put out, and we also attract. And our mind puts out this frequency. And, this is actual science. They show that when you die, you lose, I forgot the exact amount of weight, but scientists say that's the mind. The mind, separate from the brain, it's its own thing. And so that puts out and receives a frequency. It's a transmitter. And so the thoughts that you think go out, and you attract thoughts that are on that same frequency. And it's, you know, it's the law of attraction, but it's really more complicated than that. And this is not something that I'm making up. This is, you know, universal laws and principles. A lot of it's based in quantum physics. And yeah, so you have to be careful what you put out, because that's what you attract. So if you're only putting out, you know, the focus on your disease and what you don't want and your symptoms, and you're focusing on all of the negatives, that's what you're going to keep attracting back. But if you are able to focus on what you do want and what that vision is and really feel into it, that really shifts. And if you put all of the focus on the why do you want to get well? What does that look like for you? How does that affect your relationships and your career and your life and your happiness and your health and your vibrancy? Focus on that. Focus on the why, and the how will come. Things will come up. This is how the universe works. There are, you know, this is real science. You attract those frequencies. So all of a sudden things just fall into place, and a protocol comes along that seems like a good fit for you. You don't have to be so hyper focused on how exactly you are going to heal yourself, but you really, really need to lean into why you want to heal. What does your life look like? And start feeling into that and visualizing it and repeating that. It takes repetition. It takes practice. It's not easy, but it's simple. It's simple. Your thoughts create things. Your thoughts create your reality. It's really that simple, but you have to actually practice it and put it into habit and believe it for it to happen. So focus on the why, and the how will follow. You don't have to figure everything out. That's adding stress. That's adding anxiety. It's a daunting task to be your own doctor. But focus on why you want to get well, and trust the process, and listen to your body, and find practitioners that you trust, and just put your focus on the why and attract the frequency of what you actually want, not what you don't want. So I hope everybody has a wonderful day.